Good afternoon, everyone. It's been a long 2 days, but I'm happy to be here with you on this session on health, and specifically on infrastructure in transition. We will discuss the adaptation of climate change impacts on national health systems. And we have a stellar lineup of fantastic speakers here today who will shed light on, I think, what is the most pressing challenge of our time: climate change and nature degradation and its effect on human health. Health is really the human face of climate change, and it's disproportionately affecting vulnerable populations in many of the countries where AIIB operates. It is by far the greatest challenge of this century, and it is the greatest threat to, frankly, our survival and well-being in this century. Already about a third of mortality, death globally, is due to environmental causes, and this is only likely to escalate in the coming years to come. How we act now, how we prepare ourselves for this, will greatly impact not only how we will be able to receive care and how we will be able to thrive, but really about future generations to come as well. Health is wealth, as they say, and I think this is important to remember. As an infrastructure bank, we are very proud to say that we had our first health strategy coming out, and that is to a lot of hard work and efforts of some of the people sitting in this audience today. And we are very proud to say that it's a health strategy, not a health sector strategy, and really emphasizing the importance of thinking holistically when we think about health, thinking beyond the healthcare sector and really what is actually affecting our health. And we know that disproportionately what affects our health is actually beyond the healthcare sector as well. So really thinking about the holistic approach on nature, climate change, and environment in general. We also had, and I wish I had the actual report here, but I couldn't find it in the booth now. We launched our flagship report on infrastructure for planetary health earlier this year at the FIX Summit in Cape Town in South Africa, and really outlined the interlinkages between nature, health, and climate. And we encouraged in that report really to think, for the MDBs as well as a community, to think broader when we think about health and well-being, and really optimize the opportunities of health in all sectors. We are an infrastructure bank at our core, but many of the sectors that actually we work on, such as transport, infrastructure, water, sanitation, renewable energy, and so forth, are large determinants of our health as well. I would actually like to invite our first keynote speaker to this event. Dr. Chris Kipto is the Principal Secretary of the National Treasury of Kenya. Dr. Kipto was appointed in 2022, and prior he served as the Principal Secretary for Ministry of Environment and Forestry, so bringing in a lot of rich experience from that, both on environment, climate change policies, trade policies, regional integration, private sector development, advocacy, and infrastructure development. So with no further ado, please, Dr. Kipto, the stage is yours.
Your Excellencies, distinguished guests, ladies and gentlemen, good afternoon. Or is it morning? In Kenya, we say jambo. When I say jambo, you say jambo. Jambo. Yes, I'm happy to be here today. I think you've heard from the introduction. I have served previously in the Ministry of Environment and Forestry. So I have a rich experience on matters climate change, If you look at the work Kenya has done, I think we say we are a climate leader in many respects. You look at our policy framework, legal framework, regulatory framework. And we were among the first countries to submit our updated NDC, National Determined Contribution, to UNFCCC. We did a second one, and in those two cases, we were ambitious when it comes to reducing emissions. Even though Kenya, like many African countries, has very little in terms of greenhouse gas emissions. Our contribution is very little. Yet we bear the greatest brand of the impacts of climate change. So today I will focus myself on the topic that has been given, which is on health infrastructure in transition, focusing on adapting national health systems to climate change impact. So it's an honor for me to stand before you today at this critical gathering to discuss a challenge that transcends borders, the resilience of our health systems in the face of climate change. I believe you will agree with me that climate change is no longer a distant threat. It is here with us. It is reshaping lives, economies, and ecosystems. For Kenya and many nations, its impact on health is profound. Rising disease burdens, strained infrastructure, and vulnerable communities. The recent floods, droughts, and heat waves across Africa have exposed the fragility of our health systems. Today, we must confront a pivotal question, which is, how do we future-proof our health infrastructure to safeguard our people? I think that is the critical question. So in answering this question, I will give my perspectives in the context of Kenya, because we are a nation at crossroads when it comes to matters climate change, as I have just indicated. Kenya's health system, like many in the developing world, faces dual challenges. First challenge is that we have climate-induced health risks. And here I want to focus on increased vector-borne diseases like malaria, waterborne illnesses, and malnutrition that come as a result of extreme climate change or erratic weather conditions. The other challenge is infrastructure gaps. And here we have less equipped hospitals for floods or power outages. We also face supply chains disrupted by extreme weather. And we also have underserved rural populations. Yet, in adversity lies opportunity. Under Kenya's Vision 2030 and the Universal Healthcare System agenda, we are reimagining our health infrastructure through a climate lens. So let me give three areas, what I would call three pillars of Kenya's health infrastructure transition. The first is climate-smart health infrastructure. As I've indicated, Kenya faces increasing climate-related challenges, such as droughts, floods, and changing disease patterns, which directly impact our healthcare delivery. So we in Kenya are investing in solar-powered health facilities, especially in remote counties. Some of you know, maybe my friend who said he comes from Kenya, he was born in Kenya. If you know Turkana and Mandera, in that region, we are using solar-powered health facilities. And in that region, we don't have electricity. So we don't have grid electricity. And even when it is there, it's unreliable. So doing a lot of investment in solar-powered health facilities. And we are also focusing on rainwater harvesting, which is being integrated into hospitals. For some of you who know Kenyatta National Hospital, so that we ensure there is water security, especially during times when we don't have sufficient water like drought. We are also embracing flood-resistant designs. And if you know the coastal and western Kenya regions, which are mainly prone to flooding, we are, most of the hospitals now are adopting flood-resistant designs. An example is Malindi Sub-County Hospital, which has incorporated elevated structures to prevent flood damage. And we are also taking on board digital, we are going through what we call digital leap. And we have a mobile penetration in Kenya of over 80%. And this mobile penetration has helped us because it has facilitated widespread use of telemedicine and M-health platforms such as M-TIBA. M-TIBA is a mobile health wallet platform, which our Safaricom, for some of you know, and some of its partners have used to be able to provide telemedicine and other healthcare services. These platforms enable remote consultations and health information dissemination, crucial during emergencies like COVID-19 pandemic or flood diseases. The other aspect is on financing. We have resource constraints that require that we must be innovative when it comes to raising resources. So we have established a Kenya Climate Change Fund, and we have also gone ahead to integrate climate priorities into national health budget with increased allocations to climate resilient infrastructure. If I had time, I would have given you more examples, but I want to save time for the rest of the panelists. We have also embraced global partnerships. So here, we have actively engaged with Green Climate Fund, having secured funding for projects like climate resilient water and health infrastructure in arid and semi-arid lands. The World Bank's support through programs like the Kenya Climate Resilience Program helps us scale up climate-smart health infrastructure. And we have also embraced private sector and innovations. Here, we have a burgeoning tech sector, exemplified by startups such as what I earlier referred to as M-TIBA. And we have also attracted private investments into health tech solutions that enhance resilience. And I believe my friend here is on his way to Kenya. I want to invite you to come and invest in private sector because we cherish private sector investments. We have also embraced public-private partnerships, and we have explored this, for example, on solar-powered clinics and mobile health services. And finally, we are addressing this issue of climate justice, trying to make sure we have equity. So we have vulnerable groups, especially women, children, pastoralist community, and marginalized communities who are disproportionately affected by climate change impacts. In counties like Turkana, Marsabit, and Wajir that experience recurrent droughts, the communities there face, they are threatened by health, and their health and livelihoods are threatened by climate change. So what we do is that we have prioritized these groups to ensure equitable access to health services. Then we have also embraced what we call community health promoters. We have a strategy that has deployed 107,801 CHPs, that is community health promoters, across the country. Their role is to deliver maternal health, immunization, and disease surveillance, even during floods or droughts. During the COVID-19 pandemic, for example, CHPs played a very vital role in outreach and vaccination campaigns in marginalized areas. So we have special programs which are being rolled out to address malnutrition and waterborne diseases in vulnerable communities affected by climate variability, ensuring no one is left behind. So in summary, I want to say that Kenya's climate resilience in health is grounded in innovative infrastructure, strategic financing, and inclusive community-based approaches. The country's unique geographical and socioeconomic context informs tailored solutions, emphasizing that climate justice and resilience are central to sustainable health development. So let me make a call to action as I conclude. The climate crisis knows no borders. So we urge, one, global solidarity in technology transfer and capacity building. Two, we urge that we embrace innovative financing solutions like debt for climate swaps to free up fiscal space for health adaptation. We are already engaging a global fund, for instance, to do a debt for health swap, where we can be able to raise financing, and whatever money we raise out of the swap, we are able to direct it back to the health sector to address some of the challenges. And finally, we are saying we would like to embrace research partnerships to tailor solutions for African contexts. So, let me close by saying that we need a resilient future. Let us remember that climate-resilient health systems are not a cost. They are an investment in stability, growth, and human dignity. Kenya stands ready to collaborate, to innovate, and lead. Together, we can turn the tide. Thank you very much.
Thank you so much, Dr. Kitwa, for your inspiring words and also for really making us all think that there are a lot of different solutions out there, and the more we share the knowledge on these solutions, the better we can be together. With no further ado, I would like to invite the distinguished panel that we have for this session. And our first panelist is Martin Taylor, who is the representative of WHO in China and has served at this role since 2023. And Martin was previously the director of the Division of Health Systems and Service in the WHO Western Pacific region. You have over many decades of experience within the global health sphere, and were actually one of the founding members of the Global Fund as well. Please welcome to the stage, Martin. Give him a round of applause. So, to our second speaker today, I would like to invite Priya Basu, who is the executive head of the Pandemic Fund, also a partner of AIIB. I have a long decades of experience in multilateral institutions. You were part of leading the task force on COVID-19, as well as engaging with the pandemic preparedness and response under the G20 and G7. You have, I was reading the number of organizations you worked with is quite impressive. World Bank, IMF, ADB, UNCTAD, International Labour Organization, and many more. Priya, please welcome to the stage. So to our third speaker of this session is Nabel Guer, who is the Vice President and the Chief of Asia, Middle East, Europe for PATH, which is a social enterprise in biotech, human-centered innovation, and global health, also a partner of AIIB. Nabel, you previously served under the Commonwealth and the UN system and have a wealth of experience as well within these organizations. Please welcome to the stage. Last but not least, I would like to welcome Abrar Mir, who is the co-founder and managing director of Quadria Capital, a leading healthcare focused on private equity firm. Quadria has invested, I think, in over 30 leading healthcare companies through Southeast Asia and South Asia, and is also a partner at AIIB. Please welcome to the stage. Far from each other, but but I hope we can feel like we're in a small room. So I'm very excited about this conversation. I think all of you here on the stage bring a wealth of experience from different organizations and different sectors as well. And I would like to start the first questions to you, Martin. I think we are at this venue here today at the 10-year anniversary of AIIB and our annual meeting. Not everyone in the audience may be health experts. So I would also like to set the scene and really, if you can provide your perspective from WHO on climate and health and you know, where do you see this intersection and the importance of that, and maybe stress a little bit of what WHO is doing in this space.
Thank you, Vera, and thank you very much for not just inviting me and all of us to discuss, but actually to the AIIB for putting on a panel on this topic. I think it's fantastic that a bank that focuses on infrastructure is asking questions about climate change and health. You asked about WHO, World Health Organization. So our Director General, Dr. Tedros, has been pretty clear for a number of years now about the impact that climate change is having on health. He has advocated very strongly, and with WHO working with the organizers of the last two COPs, there have been specific days at those COP events focusing on climate change and health. So for the last 2 years, that's been the case. Climate change has been identified by WHO as one of the biggest risks to human health in the coming decades. And in our global program of work, so we have a 5-year work cycle that was established last year in 2024 and agreed by all our member states that identified climate change as one of the major challenges. And that was not just a program of work for WHO, that's for WHO, but also for countries and other partners as well. So it's a kind of collective global strategy, so to speak. So it's been identified as a real challenge. Maybe in terms of, you asked a little bit about the connection. I mean, I think some aspects of the connection are well known to everybody. It's not uncommon to read in newspapers stories about heat waves or flooding, stories about malaria and dengue, changes in transmission patterns and that kind of thing. But I think it goes much broader than that. And so just a few examples. So not only are we seeing changes in disease patterns for communicable diseases and geographies and populations who are becoming exposed who weren't previously, we're also seeing a very increased burden on non-communicable diseases and people's lifestyles. Extreme heat, I think, is probably one of the biggest examples of that we see. But there's other aspects in terms of extreme weather conditions that are impacting on people's lives. And that includes, for example, something as basic as not being able to go outdoors, the impact that has on productivity, the impact that has on somebody's ability to exercise, and therefore the knock-on impact of that lack of exercise for people's physical health and can be their mental health as well. So you can see many different ways in which the connections can be drawn. And that's before we even start to talk about the populations who are being displaced because of climate and the impact that has on their health in terms of being vulnerable populations, moving to places where they may not have the right conditions to be able to preserve their health, or also the lack of healthcare. So globally, those different factors are all coming into play and in different ways in different areas. Globally, we assess that there's about 3.6 billion people who are living in situations where they are particularly vulnerable to climate shocks. That has a huge potential burden in terms of the costs that entails, in terms of premature mortality. There are some estimates that means for the next couple of decades, almost 250,000 people every year. And that's not from all climate change, that's just from the top 4 factors related to climate change. Last thing before I conclude. So for those of us who live and work in a country like China, a very geographically diverse country. You see this every day and every week in terms of, because of the diversity of the country, with the extreme heat, the flooding, typhoons. It's a constant news cycle. And it also, I think it points out to us not just that it's there, but it's very different in different parts of the country. And so when we come into conversations about how we need to prepare healthcare systems to adapt, it needs to be very localized to those particular contexts. Not just localized in terms of making sure that the healthcare system is resilient and robust, whether we're talking about rising sea levels or flooding risks, but also localized in terms of the disease profiles and the burden of disease that is present, but also expected in the future. And just one last aspect on that before I conclude. We know that many healthcare systems and the infrastructure around them are based on the challenges of the past. And a lot of that is based around the challenges of providing acute care and communicable disease care, infectious diseases. We're now in many countries, and this is particularly the case in Asia and in China, looking at a situation in the future where we have increasing aging populations. That's a good thing because people are living longer, but often they're living longer with chronic conditions. And they are often the people who are the most vulnerable when it comes to extreme weather, especially when we're talking about extreme heat. So when we're planning for healthcare systems for the future, I think one of the key factors that we need to bring into account is how this is going to affect the demand and the need for healthcare systems in the future, and therefore how we think about the infrastructure that will be needed, but also not just the infrastructure, the connectivity, the use of digital tools, other means in which healthcare can be provided and monitored in the future, given those changing disease burdens and patterns, of which climate change is going to be one of the drivers.
Thank you so much, Martin. A lot of challenges, that's for sure, but also a lot of solutions, hopefully, out there that we'll be able to shed light on. I want to go now to you, Priya. You are leading the Pandemic Fund, which was set up during the pandemic, and I think particularly now with the growing evidence of the intersection between climate change, nature degradation, and health, and you know, very much, you know, pandemic and zoonotic diseases being, you know, part of that link. I wanted to kind of ask you a little bit, like, how is the Pandemic Fund working in this space, and really how is that kind of trickling down in your vision and mission as a fund?
No, thank you very much. And first of all, let me add my thanks to you, Vera, and AIIB for organizing this session, and to the audience for showing up for the last session on the last day. It's great to see such a fantastic turnout and the interest in this topic. So, yes, the Pandemic Fund comes out of lessons from COVID-19. We are the first of its kind multilateral financial mechanism that's dedicated exclusively to investing in pandemic prevention, preparedness, and response capacity building in low and middle income countries. We were launched in November 2022 under the auspices of Indonesia's G20 presidency. 28 donors came together rapidly to put in seed capital in the Pandemic Fund, and in 2.5 years we've managed to mobilize $3 billion in seed capital, which we've moved forward to quickly allocate. Now, because we come out of the lessons of COVID, we recognize, of course, the nexus between animal health, human health, and the environment. This is fundamental to the establishment of the Pandemic Fund. As Martin was saying, you know, climate change exacerbates the risks of infectious disease outbreaks. We see climate change, deforestation, land degradation, you know, all of this resulting in animals and humans coming into closer contact with each other, exacerbating the risk of zoonotic outbreaks, which then in turn require a more holistic approach to building resilience, and you know, they require a focus on a sort of multi-sectoral approach is what we call One Health. So that is very much a fundamental principle of the Pandemic Fund. And what does that really mean? So when we invest in strengthening capacities for pandemic prevention, preparedness, and response, we do so taking this multi-sectoral lens. When it comes to disease surveillance, we are doing surveillance of diseases that originate in both animals and humans. When we talk about strengthening laboratories, we're talking of both human laboratories and veterinary laboratories and the connection between the two. When we talk about strengthening health workforce, we are focusing on obviously building the capacities of countries in their kind of traditional health workforce in terms of doctors and nurses and so on, but also veterinarians, animal health workers, and then, of course, the backbone of health systems, that is community health workers, but raising awareness also, around diseases that originate in animals. So kind of looking at a multi-sectoral way of strengthening capacities of countries. And we're a catalytic fund, so for every dollar of grant money that we allocate, we mobilize additional funds from partners such as AIIB, which is one of our founding implementing entity partners, but also other multilateral development banks, UN agencies, and so on. So far, for every dollar that we've allocated in grants, we've managed to mobilize $7 in additional financing. So 1 to 7 is our leverage ratio. So with $885 million awarded so far, we've mobilized $6 billion, and we've done some very innovative projects, for example, with AIIB in Cambodia and Rwanda in Cambodia. For every dollar of grants that we awarded, we were able to unlock $20 in catalytic financing. And for AIIB, I think we awarded $10 million to you, for which you were able to mobilize 60 million. So, it's a great ratio in terms of leverage. So we're catalytic. We also promote coordination and collaboration across different sectors, across different partners. Partnerships are really critical to what we do, because we do recognize that we cannot do this alone. So we're galvanizing these kinds of multi-sectoral partnerships across countries, and we've now got a footprint in 75 countries around the world and growing. Most of our portfolio at the moment, the bulk of it is allocated in sub-Saharan Africa, from where we're getting the greatest demands and great projects there. But we look forward to expanding that portfolio. We also have projects across all other world regions, and we're in the midst of a round of funding right now, where we hope to allocate even more in the coming months and grow our leverage ratio and strengthen our partnerships. And maybe one last word. Private-public partnerships have been very critical as well in the projects that we're supporting, because ultimately, although we are a country-driven, country-led fund where our money goes to country budgets, so it goes to governments, but then governments are procuring private sector services for delivering the kind of upgrades in lab capacity, in surveillance, in data sharing. So we have a variety of private sector firms that are engaging, and going forward, we're looking to the private sector to come in not only as vendors in delivering and implementing these projects, but also to come in as knowledge partners, to come in more upstream, and also, we're hoping to mobilize private capital to grow our pot of funding. So let me stop there, and thanks again.
Thank you, Priya, and I think you touched upon some really important things there. First of all, the 1 to 7 ratio, that's good, and hopefully that will grow as we see this fund also moving forward. I think an important part that you also touched upon is really this, that we see, the intersection between humans and animals, specifically wild animals, and the more we move towards, harder climates, more extreme weather events, more degradation of nature, the most likely it is that we will have more of those pandemics. It's not when, or it's not not whether or not we will have a next pandemic, it's when we're going to have it. And there was an interesting panel that were put together after the pandemic that really spoke to, what have we done now, and are we any better prepared? And out of the 10 bullet points that came out, it said that none of the 10 recommendations has been accomplished, so we are not better prepared. So very important work that you're doing, and we hope to continue that work together with you. I want to that's what I'm doing as well, but I want to move now to you, Neville, and to PATH. You're an organization that, as I was looking through, are working, I think I have staff in more than 70 countries, and I think work in many more of those countries as well. You've been a technical partner for AIIB as well, but have done some very critical work. I think you mentioned before we started this session that you're the boots and the brains on the ground. And we are very grateful to be a partner with you on that. But given that PATH operates in so many different countries, and we talk today specifically about this challenge of health systems adaptation to climate change, what are your observations in the countries where you work, and maybe share some light and examples of innovative approaches that you are helping work together with private and public sector to manage this challenge?
Well, thank you, Vera. First of all, very good afternoon. We can do better. This is a health session. I was expecting better. Very good afternoon. Thank you very much indeed. Firstly, congratulations to Asian Infrastructure Investment Bank on its 10th anniversary. This comes from a 50 years old organization. So you have done 10 years and have done a great job. So congratulations on that one. Such a huge pleasure to be part of this distinguished panel. You have cleverly asked me 2 questions in 1 question. The very first one is, how do we make sense of the situation in countries where we operate? 74 in total, mostly low-income countries, middle-income countries. Unfortunately, I don't have a good news. I have to be honest. It's slightly pessimistic. There are 3 Ds which are killing these countries. The Honorable Minister talked about debt. So debt distress is a big one these days. The second D is the increasing disease burden. We have talked about it. Martin talked about it. Not only the regular diseases, the normal diseases, but also climate-induced diseases. So that's also going up. The third D is, unfortunately, development aid, which used to be the lifeline of many of these LDCs and LMICs in the last 80 years or so. Almost 50 billion has been wiped out in the last 3 years. And today's shocking news, of course, is Gavi replenishment is going on, and there's not that great news coming from that part of the world. So these 3 Ds are then exacerbated by the climate angle. So what is happening is that everything which was happening and going downwards, that thing has accelerated and unfortunately sped up. So that is where we are in these countries where we operate. So more is needed rather than less, and better is needed. How we are dealing with it? Are we in the adaptation space? The second part of your question. You'll be pleased to hear that we are taking the AIIB approach, but this AIIB is slightly different from what you understand it. A is for adaptation, I is for innovation, the second I is for impact, and B is for betterment. So that's our framework. And again, I will say there are 3 S's and 1 I in our approach. The first one is our supply chains work. And I'll give practical examples from the countries where we work in. So we have done the greening of vaccine supply chain in Tunisia. We looked at the entire value chain from the procurement side, its storage, as well as the way vaccination is done. After that assessment, we have done a net zero supply chain in one particular country. We are now working with Gavi to actually expand and roll out this model in many other countries. So that's the first test. The second one is something in which you are expert in, which is surveillance. From the One Health approach, you do the science, we do the practice. So in East Asia and Africa, we are developing One Health models, actually practice-oriented models. So bringing in food, agriculture, veterinary sciences, human health, and climate change ministries together under one umbrella, using the One Health approach, doing a common surveillance system. So this is the horizontal part of it. And the vertical part of it is bringing the federal, state, local governments together, as well as communities, so that there's a comprehensive system in a country to deal with some of these things. Now, in Vietnam, we got $22 million from the US government to actually do the first pilot. Now we are working with the German government on another project in Cambodia, which is exactly the replication of the success which we had in Vietnam. And this is even bigger, $34 million for a smaller country. We have done the same in Uganda, and BBC has done a documentary on the work which we have done in One Health space in Uganda. So that's the surveillance area. The third one is systems, health systems. And I loved what you said, that you're doing health and not health sector. And the problem has been the siloing of the health sector. And that is looking at different components of the health sector and then seeing, okay, where can we do energy efficiencies, solarization, and many other things in the adaptive space. Happy to talk about some of the things which we are doing over there. And the next one is innovation space. In the innovation space, at the margins of World Health Assembly in May, we have established a new fund, a $120 million fund on climate change and health innovations, together with Global Innovation Fund. So they are an impact investor. We are the technical partner with them. So 100 million for them, 20 million for us to invest in 50 to 100 innovations, which will be competitively selected from across the globe. So I'll stop here.
Thank you so much, and very interesting, specifically considering the broad focus that you have on so many different countries and really being able to capture those lessons learned and hopefully share them. I want to move on now to Abra and probably get a bit of a different perspective here. You're the founder, co-founder, and managing director of Quadria Capital, the private venture firm working in the healthcare space, and you work both on delivery, technologies, and devices. So I would like to, get your perspective on, how are you as a private sector player addressing this challenge, and maybe talk to some of the things that you're doing in this space.
Yeah, thanks, Vera. Look, I appreciate all of the clarity on the issues that we're facing as far as the health sector globally and specifically in the emerging economies and the developing economies is concerned. The developing economies, as has been articulated very clearly by my colleagues, faces deep and very large disease burden, particularly chronic disease burden, and now increasingly related to planetary change. As a private sector investor, though, we're very focused on the solution. What do we do? What can we do to solve this dual disease burden? And the answer is not easy. So I'll give you our perspective. On the one hand, the economies and the countries in which we invest, in which we work, have typically individuals that earn less than $10 per day. They don't have access to private medical insurance, they don't have access to social security, and they've got to access high quality care for chronic disease like diabetes or cancer, or even respiratory disease through the climate change themselves out of pocket. And we can't expect our governments, and with respect to you, Minister, to just increase their healthcare budgets. Just to give you context, in most of our economies, emerging countries spend something like 2 to 3% of their global budget, of their annual budgets towards healthcare. The US and Europe comparatively spends about 20%. So our part of the world can't go from 2 to 4%. So the answer from our perspective isn't actually looking towards government saying, guys, can you help us fund the solution to the health crisis that we are facing and that we may face? And so for us, we think that it's actually the private sector that needs to lead the way. It's the private sector that needs to create sustainable business models that can deliver not just high-quality healthcare at an affordable price, but also be successful businesses that can deliver superior economic returns to their investors. That creates a virtuous cycle that becomes an evolving revolution in a way of how to create healthcare in an ecosystem that needs it desperately. And the challenges are immense. We recognize that. The challenges are immense. But from our perspective, what's very clear is that there is an opportunity, particularly in our part of the world, to create business models that are specifically suited for the economies in which we invest, particularly for lower income economies, where bringing healthcare at scale, at an affordable price to as many people as possible, is doable at a very affordable price and still at a very economic way. But I don't want to be sounding, especially given some of the comments that we've heard, as the heartless capitalist sitting on this panel. You know, I recognize that healthcare also isn't just a sector. Frankly, it's a lifeline. You know, it's the foundation on which families, communities, and even economies are built. And I honestly believe that our hospitals and the waiting rooms in our hospitals see probably more sincere prayers than any church, mosque, or a temple. And health, frankly, is the human face of climate change. And yet, within climate change, only less than 1% of all the capital that's actually been deployed through climate change financing has gone to health. And that's, frankly, the reality. So from our perspective, what we're very focused on is to say, okay, we recognize that there are financing issues, there are disease burden issues, there is payment issues because individuals earn $8 to $10 per day, but at the same time they require health at an affordable price and of a quality at a human level. We, the private sector, have to lead the way. We have to create those ecosystems, and that's frankly what we've been very focused on. And I'll just, before I pause, just give you one example of why we think that's feasible. When I moved to Asia, the first investment we ever made was in a small business called Parkway, which we merged into another business, which we continued to develop, which we ultimately sold to a sovereign wealth fund. That business today is the world's largest hospitals group by market cap, by revenue, by profitability. And it's an illustration of how scalability can become a virtuous cycle of positiveness.
Thank you, Brian. I think very interesting examples and different perspective here as well. I mean, it's also important to notice that, I mean, we're sitting in Asia, and the vast majority of Asian countries have pretty much a 50-50 balance, 50 private sector provision, 50 public sector provision. So I think it's important to recognize that, you know, if you want to go fast, go alone. If you want to go long, go together. So this is a very needed conversation also on how we can work together. And then we have the public-private partnerships in between there as well. But I want to go back to Nabel and maybe ask you a little bit about coming back to what I think everyone stressed in this conversation. The vast majority of people who will be affected by this are the most vulnerable, the most marginalized, specifically women, you know, children, elderly population. How are we going to provide equitable services to this population? We already have a very, you know, stressed healthcare system. I think Abra spoke to, you know, what the private sector can do, but you're sitting from a more technical point of view, working a lot with governments as well. What do you see as, adaptive strategies that really provides a more inclusive approach in terms of accessibility?
Thank you, Vera, for your question. I was hoping that I'll be the third one in the line once again, but if you allow me, can I make a comment on what has been said by Ebrar? And if you don't mind, it'll make our conversation perhaps a little spicy. And here's the government sector, intergovernmental organizations, government sector and the private sector. So here's the social sector in between. Looking at it from our perspective, where we see it not as mutually exclusive or binary question, be it the public sector which should be doing it or the private sector. I think both should be working together. They have their space, and it's all about the best mix or the best balance which you have in a particular country or in a particular context. Now, going back to your question, we're doing a lot of work, especially with AIIB. This is an inclusion question. And I come from an organization which has a mission of health equity. So this lies at the heart of our work. We have been doing it for 50 years, and inclusion is the most important part of it. Now, for example, we do the vaccines work. The private sector will not invest in certain vaccines, such as malaria, certain diseases such as neglected tropical diseases. There's no money to make over there. So we have developed the first ever malaria vaccine. This is PATH's 20 years of work, which is now being rolled out in Africa. And actually, the hub of our operations for that one is Kenya. We're doing it in 15 countries. So some of that work, which is not supported by the private sector, is supported by both governments as well as philanthropists such as Bill Gates, who has invested a lot of money in this one. Now, banks like Asian Infrastructure Investment Bank are very important partners in this inclusion process. And we are proud partners of Asian Infrastructure Investment Bank. We helped the bank think through the strategy which it has. And I'm very proud that we were part of those conversations where we arranged meetings for the bank in Geneva. We brought WHO, Gavi, Global Fund, Pharma, all together to have those consultations at one point in time. We are your ears and also perhaps your nose also in terms of understanding and sniffing what kind of need exists at the country level. So I have done 3 studies, market studies for Asian Infrastructure Investment Bank, not only from the investment perspective, but also from the inclusion perspective, because that is our mission. That's what brings us together. We are about to sign another agreement with the bank. It has not been signed, so I can't talk about it. But it's also in a big country where we are looking at heat stresses and how these heat stressors are impacting it's not heat, just climate change stressors, including heat and pollution, and how they're affecting the most vulnerable communities, as well as some areas such as urban slums. Perhaps part of my own understanding is that part of that loan will be assisting them. So the heart of the work which we are doing together with the Asian Bank and with other organizations is about inclusion. It's about social justice and equity.
Thank you, Nobel. I'll come back now to you, Martin. I'm flipping around the circus here a bit. And I mean, we're here in China today. China has been one of the countries that have had a remarkable journey in terms of improving health outcomes and also improving environment outcomes in recent years. I wasn't here 10 years ago, but I hear that the skies were more gray at that time. And I want to ask you, both from a perspective of us as an MDB and AIIB, but really also from a global community perspective, what can we really learn from China's experience? And I think there's many times very little that is being shared about the China experience. And there's a lot of interesting things that China has done at an enormous scale. So I wanted to get your perspective on that, and how can that be translated through our work as well into other countries?
There's a number of ways we could explore that question. So let me start by the kind of the policy side, and then some of the innovations that we've seen. The first, actually, I think, which is interesting and which is a model to be seen yet, is last year China's government established the first climate change and health adaptation plan, linked with the national adaptation plan. The content is relatively similar to what you would expect in many countries' adaptation plans. I think the significance and the importance of it is that it brought together 12 different government ministries and agencies and directs them and other government partners in society to explore their role in climate change and health and develop their actions that they need to be taking. And I think that's significant because it sends a very clear signal that this isn't just a health problem or an environment problem, but it's for all sectors of society and all sectors of government to work on. And having seen in the past how similar such plans get taken forward, I imagine that when we're looking in the future, we'll see that the different ministries and different parts of the country will respond to the signal that that plan sends. So I think that's the first thing. Second, immediate measures which China takes which improve people's health at the climate change health nexus. You've mentioned air pollution, which is, I think, the classic example, and for those people who weren't aware, I mean, air quality in China a bit more and a bit less than 10 years ago was a cause of huge concern and was a major population concern that people were talking about as well. So it wasn't just a silent concern. Again, that took government efforts from many different sectors to work together to address that. And I think it shows that when there is the leadership and the commitment to take action, it can be done, and it can be done relatively quickly. You mentioned air quality, but you can also look at the waterways around Beijing and see the cleanliness now of the waterways and people swimming in them in the summer and enjoying water sports, something that would have been inconceivable 10 years ago. But I also want to highlight another action which is taken, which is also protecting lives right now, which is the connection between the health sector and the meteorological sector and the investment that there's been in surveillance and early warning, so that measures can be taken to protect populations, sending out alerts when there's going to be extreme heat conditions, but also enabling healthcare systems to be ready for the increased burden. And that's a significant one. In China, in the last, so in 2023, compared to the kind of baseline average, there was a threefold increase in the exposure that people have per day to heat wave. Per year. And that has resulted in almost a doubling of loss of life. So this is quite significant, and it's a significant challenge in China. And so that action that's been taken to link the monitoring and the early warning and the prediction, I think, is a significant one that can be used as an example, not just because we're often thinking about the long-term impacts of climate change, or actually right now, and actions that can be taken right now. Last thing I would say, which I think is an open space, and one for yourselves and other investors to consider, is I think we all know that healthcare sectors themselves are significant emitters, and there needs to be action taken on that. And bringing together China's innovation into that space, I think, has huge potential. We haven't seen that yet, but there is huge potential for the healthcare system in China and for the supply chain to bring the innovation in that can help decarbonize. So I think that's something that we should be looking for and encouraging China to potentially become a significant global leader.
Thank you so much, Martin. And that's very promising to hear that, you know, when there's global leadership and commitment, things can be done quickly. Please.
If I may, just one sentence related to what has been said. 5 partners, WHO, World Meteorological Organization, Rockefeller Foundation, Wellcome Trust, and PATH. We are working on a guidebook, on a global guidebook on climate change and health, especially focusing on weather systems and how to include that as part of the surveillance system. It's almost ready. It has not been published yet, but it's almost ready. So we are proud partners of WHO and WMO also in that space.
And I want you all to remember, especially you who are not in the health sector, that we had the first health day at COP28. So it took 28 years before we could talk about health and climate in the same sentence. So, you know, where we are today, it's quite remarkable, and that we can have this conversation in so many different spaces is very, very promising. But it took a very long time. I think we were focusing on or thinking of the polar bears for too long and not about ourselves. But maybe coming back to you, Priya, I mean, Pandemic Fund, again, we are partners in this, and you work with several different MDBs really on the Pandemic Fund. And I wanted to kind of take it back to you and challenge us in a way of how we can work better, both with you, but, you know, really in this space as well, and through the work of the Pandemic Fund, like how can AIIB as well really think about doing more and doing better in this space?
So thank you for that question. I mean, I think, you know, now more than ever, against the backdrop of constraints in international development financing, you know, we really have to think creatively about how we can maximize the impact of every dollar of grant resources that we award to low and middle income countries for this agenda, but also, you know, across the development agenda. And in many ways, you know, the Pandemic Fund, when we were established, we were ahead of our times because, you know, we wanted to build a model that is not perpetually dependent on overseas development assistance. You know, we recognize that ODA is, you know, going to be limited, and that it's our collective responsibility to sort of make sure that the money that's awarded to countries, you know, through these projects is really sustained, and the only way it can be sustained is if countries take ownership and if countries, you know, put their own resources. So kind of that's one point I want to make, because we cannot develop funding models that are aid dependent. Our funding is only going to work if countries own what we do and if countries are willing to put in their own resources. Now coming to your question of partnerships, you know, absolutely, again, you know, fundamental. There are so many actors in the global health space. I mean, just on this panel, you heard about so many different funds that are being sort of set up for different, you know, by different actors, you know, around the same themes. And so I think, you know, collectively, we can do much better than if we work sort of individually in silos, and the whole can be much larger than the sum of its parts, which isn't the case right now. So again, the Pandemic Fund model is very much based on partnerships. We have, at the moment, what we call 13 implementing agencies. We just got one new one, which is UNDP. So, you know, on this stage, we have WHO, which is one of our implementing partners, AIIB, another implementing partner, PATH. I think you've been a delivery partner in the projects that we've done. And to all of our implementing entities, including particularly the 7 multilateral development banks, we're saying, you know, please partner with us and bring your resources to the table. As I said, you've already done that, AIIB, in the projects that you've partnered with us. In Cambodia, I mentioned, in Rwanda, it's another example where, you know, AIIB brought significant co-financing. The government of Rwanda also brought its own money. But across the board, you know, we need to strengthen these partnerships. And I think one way of doing that is really sitting down and thinking programmatically, you know, what is AIIB's pipeline in sort of the health sector or the health system strengthening agenda, or the climate health strengthening agenda, One Health, whatever, however you call it. What's your pipeline in the coming 3 years? And then, we work and we plan together and we say, all right, the pandemic fund has these resources, use this grant money to soften the package and incentivize governments to take on more, for a pandemic prevention, preparedness, and response. And so maybe one last point, that it's not been easy. It's hard for governments to make choices. When they come to when multilateral development banks go to governments, there are many different things that governments can take loans for, and some of the areas or sectors produce quicker results and produce more visible results. When it comes to pandemic prevention, preparedness, and response, these investments are not necessarily visible because the benefits of these investments, only sort of show up in the sense of averting a pandemic. And you'll never know what the cost of that pandemic would have been in terms of the lives lost and in terms of sort of GDP lost if you avert it. So our goal is to prevent infectious disease outbreaks from turning into pandemics. But the smart thing to do, I think, as COVID has taught us, but also past pandemics, SARS, MERS, avian influenza, Ebola, Zika, each time, we find ourselves ill-prepared. And then we see, well, the investments that we could have made were a tiny fraction of the costs that we've incurred because we didn't invest. So, that's kind of our value proposition. And we say, please partner with us. To everyone on the stage, let's partner together. Let's make the whole larger than the sum of its parts, and deliver together to strengthen resilience.
Thank you, Priya. I like the better than the parts. I want to come back to you, Abra, and I think, to Priya's point as well, there's a lot of need, clearly. I think the estimates of the healthcare gap is enormous, and specifically in many low middle income countries, and we don't see this, being sort of covered anytime soon. And I think you mentioned also specifically, like, the spending on GDP on health in many of these countries is quite low. So how do we bridge that? So, and AIIB also has a very ambitious plan and goal of 50% private sector or private capital mobilization by 2030. So, in the healthcare space, I think it's important to and I really want to ask you how, both in terms of maybe shedding some light on what are some of the challenges to actually get more private money into health under the umbrella of MDBs, but also specifically to this point to really tackle the challenges that we're facing now with climate change and nature degradation. So really also providing that equity perspective again. How do we make sure that we can bring in the private sector at the right time for the right cause?
Yeah, thanks, Vera. Look, at a general level, whether it's public or private, the fact essentially is, and I'll talk about the Asia context, there is about a $60 billion healthcare underspend each year in Asia just to get to minimum healthcare levels. And every year that number balloons. It becomes larger and larger, so that catch-up needs to accelerate. Now, I think that we also recognize with respect that it's hard for us to expect governments to fill that gap. The private sector, we think, is increasingly playing a role, but it needs a holistic approach from every aspect. And I think that that fundamental reshift is so critical to the future generations because it's the systems that we build today that will determine whether our next generations will either suffer from the next pandemic or will be prepared for that. Now, the question is, therefore, how? And how can we do that? And I think that unless there is a fundamental rethink around how healthcare can be delivered in the most efficient way in the most practical and affordable way, and who pays for it, whether it's the private sector, the individual, or the public sector, is less relevant. It's all about quality and affordability and scalability to reach as many people at the most efficient price as possible. The issue is in that the current system in our markets, in the emerging markets, simply doesn't work. Again, let me give you context. We have huge disease burden, historic underspend in healthcare. We have the increasing now burden from climate change impacting health. And if you bring that all together, it's the number one reason for continued poverty in most of the economies in which we work. An unmet medical need, an unexpected accident in a family is the number one reason for the cycle of poverty in communities. If someone falls ill, they'll sell their land, they'll sell their means of production just to pay for that individual. That's what healthcare is. So unless there's that fundamental reshift. Now, what do we mean by a fundamental reshift? We're at a government policy level. Certainly, we believe there should be stronger regulation that encourages private sector. Now, private sector investment ultimately is motivated, and I agree with Priya, much as I wouldn't want to, that we are very profit-oriented, but that doesn't mean that we only chase profit. So let me give you our context. In our businesses, every business that we've ever invested in, we have never taken a penny out in dividend. Every profit that we've made, we've reinvested for further scale. We have a further policy in our hospitals that even if an individual comes from abject poverty, that we will never turn them away, that we will bring them into our hospital, treat them. But as an investor, how we make our capital, how we make our returns is through that scalability. Is that if we reinvest, if we take a group that we invested with 10 hospitals, but at the end of our period, that's 100 hospitals, and we can then sell that at a higher price, that's our profitability. But that alignment needs to come at every level. Now, at the policy level, unfortunately, climate change has been both in favor as far as rhetoric is concerned, out of favor, unfortunately, when it comes to actual policies of tax incentives or tax punishments to the people that are causing that climate change, whether that's in the West or whether that's actually even in the East or the South. At the same time, the private sector, I guess, needs a lot better support from the ecosystem for us to be able to really survive. Because we also recognize that actually turning just to the public sector and expecting them to pay for it is just not a reality. Otherwise, we're all just trying to rearrange the deck chairs on the Titanic, right? And that's not good for everyone. So from our perspective, really driving the solution is much more important than just focusing on what the issues are. And that's really where we're most focused.
Thank you so much, Abra. I know we are running out of time, but because you have been such a fantastic audience showing up at this hour, at this time of the conference, I want to give the opportunity, at least for maybe if there's a question or two to the audience before we close this session. Any burning questions? Do we have a microphone somewhere?
A very good evening. So I have two questions. The first is, if we were to just deep dive a little bit into what are some of the hotspots where you think multilaterals can come and fund health infrastructure in transition. So be it within the climate resilient pool or low carbon health, be it supply chains and so on. So we've talked about the theme at large, but we also know that the agenda is now moving towards specific interventions and operationalization. And as we think of what the package of solutions and the best buys can include, just some thoughts there, and what are areas. I mean, there was, for example, the area of early warning systems that was mentioned, and linking the work of, say, within the UN system between WHO, WMO. So that's one example. But if I could hear your thoughts a little bit more on that in terms of concrete interventions. And my second question is to Mr. Gohir with regard to the fund, and it's really exciting to see that there's a Climate and Health Innovation Fund that's being set up. Could you share some details on the timeline? When is this rolling out? And I believe it's mostly for private sector entities that are looking at early growth impact initiatives. Is there scope for MDBs to also engage on this, or it's primarily focusing on entrepreneurs? Thank you.
So maybe 30 seconds each to answer the first question, and then Nabil, you can go ahead with the second. Anyone who feel that they have a good answer.
To the first question, primary healthcare that is resilient and also ready for the challenges of the future, including the aging population, growing burden of non-communicable diseases, and the climate shocks that will come as well. So I would say that second would be innovation. There's plenty of scope, and there is already, but plenty of scope for more innovation in technologies in the healthcare sector and how we deliver healthcare that we're waiting for and we need.
On the first question, I would say the best buys, if you're focused on reducing the risk of another zoonotic disease outbreak from becoming a pandemic, if that's the focus, then the best buys would be, and this is based on kind of extensive consultations that we've done with governments and private sector and civil society across 147 countries. The best buys are the areas that the Pandemic Fund is focusing on, which is number one, early warning systems and disease surveillance, number two, strengthening laboratory infrastructure, and number three, health workforce. So these are the three areas where there's the greatest needs and greatest gaps. Where greatest needs, greatest gaps in the most vulnerable countries and settings.
Well, in terms of hotspots, there are three things which come to mind from our perspective. One is heat stress, second one is air pollution, third one is infectious diseases. This is where we see a lot of impact of climate change. In terms of solutions, I can't agree more with Priya. I think it's all about prevention, and prevention is, from our perspective, better surveillance systems which are integrated and also linked to primary health care. On the second question, which was directly for me, the Thrive Fund was launched in May in Geneva. We have rolled out our first loan for an Indian company, Black Frog Technologies, just 1 week ago. I'm happy to provide more information because it's only 30 seconds which have been allotted. But in the future, I think we will be seeing a lot of engagement with the multilateral development banks in terms of investments in some of these innovations. Thank you.
Yeah, very quickly, slightly different perspective to some of my previous colleagues. The reality is, in the emerging markets, 90% of mortality is because of disease, chronic disease. And that's what we've got to treat first. That's how we're focused on it. It's cardiovascular disease, it's oncology, it's diabetes, it's all the stuff that unfortunately is killing the vast majority of the population in our part of the world. And therefore, how we deal with that, build single specialty infrastructure that is scalable, that is low capex, that's high cash flow, that actually creates the solutions there. So a slightly different perspective.
Thank you so much. It's been a fantastic conversation, and I hope you all enjoyed it as much as I did. I want to thank our distinguished speakers. I want to thank Dr. Kipo for your inspirational talk. And I maybe want to leave you with a few words. I think we know now very well the facts. I think we have identified the symptoms, we have identified the root causes. The challenge is tremendous, but the cost of inaction is even worse. So I think we need to act by courage and compassion and in collaboration. As the only scientist within the bank, I need to say we need to act at the speed of science, not of the status quo. Thank you so much for the session.